Each year, leaders of various disciplines from federal, state, and local governments, universities, foundations, organizations, and institutions gather at the Carter Center in formal and informal sessions to share their experience and knowledge and work to arrive at solutions.
Many of us had never dealt with disasters before.
We're going to be hearing from some really wonderful and distinguished speakers on the subject of the mental health needs of the country in the wake of September 11th.
The conversation that I hope we have is, how do you turn learned helplessness into learned helpfulness?
Part of what we're about at this point is, how do we help people accommodate these risks so they're not paralyzing?
Who are the mental health professionals in our country?
People need to know who's in charge.
It's also an opportunity to mobilize, as Neil was suggesting, communities and natural support groups.
We took advantage of what we had learned in September.
Where the states are in this country in terms of preparedness.
We met with the people at the Department of Defense, Justice, the Veterans Affairs, and the Red Cross to sort of review what we know about effective early intervention after trauma.
Terrorism's purpose is to disrupt. The loss of life is less significant than disrupting the way that we continue to do business on an everyday, day-to-day basis.
Terrorism also raises stigma in single events, multiple events. It can come in continuous events.
In 1992, I came to Texas, and we've had this huge tornado sweep through, and you can't see them coming, but if you're well prepared, you can manage them.
After the Northridge earthquake, we actually delivered services to thousands of teachers.
In Oklahoma City, none of us would deny the importance of understanding what happens to teachers and schools in the immediate aftermath of an incident.
One of the difficulties we had in dealing with the after effects of the Columbine shooting was preparing for the likelihood that the peak demand for services.
With anthrax, everyone who opens mail in the District of Columbia was a secondary victim. And if we learn nothing else from the sniper events, we can learn what our fear did to our children.
What I'd like to do is rumble through the ashes and perhaps come up with some lessons that we have learned.
I'd like to share with you our response to the World Trade Center event from the perspective of the medical department, Bureau of Health Services.
And I thought what I would do is to give you some of my views on how mental health is affected and how we can deal with it, given the new reality that we live with. I can remember thinking how fortunate it was that we selected a psychiatrist as the public health commissioner. We needed someone who had an understanding of what the impact on people's minds and emotions were going to be.
Part of what we must do is learn from those who've suffered through terrorism, endured, and survived. Part of what we also must do is learn from the best available evidence provided by those who've done the research or cared for the victims of terrorism.
My job is to remind you that it's work time. It's also lunchtime.
The charge for this year's symposium is in attempting to meet the mental health needs of Americans in the wake of September 11, 2001. What strategies should the federal and state governments and local communities adopt?
Best response is preparation.
Promoting resilience in the population.
Is that an integrated mental health, or is it the annex?
Natural resources. Bartenders was a very important person.
How do we provide enough dollars in inflexible priority places so that state leadership can step up and use those dollars to leverage the right change?
And from the work groups came reports.
This group was looking for a framework in their own experience on how communities respond to crisis. We felt that the federal, state, local division of labor was itself a trap. On the federal level, to move toward a broader view of mental health.
At the state level, prominent and significant inclusion of mental health issues.
At all levels, federal, state, all be focused on supporting the community.
Our biggest goal was to assure that mental health is a funded part of all crisis and disaster plans.
And to do that, we probably need to educate our leaders.
It becomes so important what we can hear and know in time of emergency. If that can be provided for the locals, then they don't have to reinvent the wheel.
We at the Carter Center, in partnership with a number of our colleague organizations, want to move this issue forward.
And this means that the mental health world is going to have to fashion strategies, preventive ones especially, for a broader audience.
and we have to impress on our leaders that we must be prepared for another national trauma, and that mental health must be part of that planning and preparation from the very beginning.